either joining for the first time or maybe don't know Lifeskills well, I wanted to take a moment and share just a little bit. Lifeskills now is celebrating our 30th anniversary this year, which we are very excited about and happy to say. So for now 30 years, we've been a trusted provider in the community here in South Florida, and we are continuing to remain dually licensed to treat adult clients who present both with complex psychiatric and mental health presentations, as well as substance use disorders. So we're able to provide the care that we do at our residential facility, which is in Deerfield Beach, and at our outpatient facility in Delray Beach, where we're licensed for PHP, levels of care, IOP, and we provide transitional housing as well for our clients who would like continued support in living. So as I mentioned, we often see individuals and our clients with mental health presentations and even some complex higher acuity mental health presentations. And we're able to provide the treatment that we do in what we call our 6 clinical pathways, which are evidence-based best practices. One of which we'll get into a little bit today, as it's a highlight for mood-specific disorders, our cognitive behavioral therapy clinical pathway. And we are joined today, as Ethan mentioned, by one of our licensed psychologists at our residential level of care, who has been with Lifeskills now for many years, Dr. Dovid Kirzner. So thank you, Dr. Dovid, for taking the time to join us today.
It's my greatest pleasure. Thank you so much, Amanda, for the introduction.
Of course.
Ethan as well for facilitating this. And of course, a big thank you for everybody joining in this webinar.
Thank you.
And I look forward to sharing the next 30 minutes or so, spending time together with you.
Yes, absolutely. And I for one, have greatly been looking forward to this opportunity to chat with you on better understanding anxiety and OCD specifically. Dr. Dovid, I know that you have extensive experience in so many different areas, but specifically within treating mood and anxiety related disorders, even adjustment issues, behavioral disorders, personality disorders, trauma, the list goes on. And one specific area for you of high interest is working with severe anxiety and even OCD. Can you tell us a little bit about your journey and your areas of specialties that have helped you be able to serve this population?
Yeah, it's anxiety disorders has really always been my passion, specifically OCD. While I work, with other populations as well, I'm trained to work with trauma and mood disorders. Anxiety, I feel, is something which is so persistent and so prevalent across all of the different populations that we serve. And it's something that I think it's something that's just unavoidable. Who doesn't struggle with anxiety, just day-to-day anxiety, even people that don't have any kind of clinical diagnosis. So I just feel that it's something, to be trained in anxiety disorders is something which allows me to be able to help people across the gamut.
Yeah, absolutely. To your point, I think that's so true. Anxiety affects nearly everyone, right? To whatever capacity that is or extent, certainly is varied across the board, but to some degree, everyone experiences it, even what we call healthy anxiety, right? So it does affect so many people, and especially during this season that we're in, which is so new and so unique. I look forward to getting into that a little bit as how we as professionals can continue to support individuals whose presentations are even more exacerbated during this time.
Right, for sure. And another thing is, anxiety is really treatable. And unfortunately, some of the typical strategies and techniques that may seem natural to somebody to use, very often they're counterproductive. So with just a little bit of therapy and some training, many people can really learn how to live and have a better relationship with their anxiety. So that's another reason as to why I really enjoy this work because you can actually see the growth and the progress over a relatively short amount of time.
Yeah, absolutely. No, I love hearing that there's hope,
Right.
in the challenges that are present. Can you start by giving us a little bit of an overview of, the typical clinical presentations that we would see at Lifeskills who present with severe anxiety? What does that look like? What are some of the key factors that we see in our clients?
So very often, there are a few dimensions. Very often you'll see people struggling with having thoughts that are very intrusive and just bothersome. Thoughts that people very often, when in formulating a treatment plan, and when asking somebody, excuse me, what would you like to see? In order to make this worth it for you, in terms of the time spent, the money spent over treatment over the next few months, what would you like to see different in your life? Very often people respond and say, I want to get to a place where I don't have anxiety. I want you to help me get rid of my anxiety.
Right.
So that's which, and we'll discover this soon. We'll talk about this, how that's not really effective. And that's one of the reasons as to why that actually helps maintain anxiety disorders, or people to have anxiety, this wish to not have it. So that's usually something which usually shows up. People struggle with a lot of intrusive thoughts. You could actually see this on their body. There's a lot of fidget, a lot of movement, a lot of discomfort with just sitting still, or even being alone with their thoughts. So sometimes people will go ahead and self-medicate, by abusing drugs, abusing substances in order to mask their pain. People also engage in avoidant behaviors. Sometimes a person won't visit a country where they may have loved ones due to anxiety, due to fear of getting on the plane, due to fear of communicating with certain people. So you see it really internally, where people are uncomfortable with themselves, and also behaviorally, where people are engaging in behaviors that are either harmful or avoiding showing up to their life in the areas that are really important to them.
Absolutely. I think that's a great highlight to remember, is that there's both the internal struggle with anxiety that we don't see, right? That our clients are sitting with, and then the external of how that looks, right? The avoidant behavior, the physical changes that you just described. And more often than not, you're right, we do continue to see just that in the individuals that we serve, and how they even will self-medicate, as you just described, to help alleviate some of those internal symptoms that they're experiencing.
Yes, I just wanted to say hello to Thatcher. Hi, Thatcher, and welcome.
He sees you. Yeah. So at Lifeskills specifically, how do you continue to best support our clients with these presentations? How do you navigate some of the conversation that's had, and what type of modalities might you implement to best help?
So typically, the gold standard treatment for treating OCD, obsessive compulsive disorder, has been and still is exposure response prevention therapy. ERP, which is a form of cognitive behavioral therapy, as well. So we do that in individual therapy. We also have groups specifically tailored for our clients struggling with anxiety and specifically OCD. One of the groups is called Thought Fitness, Coping with Obsessive Thoughts. And in addition to that, I conceptualize through a model called acceptance and commitment therapy, and which is proven to be really, really helpful for this population. It teaches them to start having a healthier relationship with their anxiety, with their discomfort, with whatever is showing up, with their, so to speak, negative emotions, right? These intense emotions that they're feeling associated with their intrusive thoughts. So we have several groups that I facilitate through the model of acceptance and commitment therapy.
Wonderful. And I know our clients eagerly await those groups. They definitely find purpose and healing, through the experiences that you provide in
Yes.
those
As
settings.
much as they love those groups, I love them as well. It's a
Yeah.
learning process. It's transactional. As much as they learn from me, I learn from them as well.
Right.
They're also provided with additional support with their family therapists, clients that with clients that suffer and struggle with obsessive compulsive disorder. They very often seek reassurance to help them feel more comfortable and less anxious.
Mm-hmm.
And that reassurance seeking very often does more harm than good. So together in consulting with family therapists, we can allow our clients to not lean on their families and not make these phone calls. Or when they make the phone calls, it's done within a therapeutic environment with the therapeutic support of a family therapist so that they don't engage in these compulsive behaviors of reassurance seeking.
Right. What a great point. Something we often see. So, as we just discussed, anxiety is so prevalent on an average day, and in general times. Now we're in this season of COVID-19, of a pandemic. And, I, for one, know that, in conversations that I continue to have in the community with individuals who are presenting with mental health concerns, with anxiety, the symptoms are incredibly exacerbated during this season. Have you noticed much the same?
Yes, we definitely see that. And we see that with some of our clients. And what's interesting is there are some of our clients that do struggle with OCD, and some of them are actually doing pretty well. And I believe that a lot of that has to do with the treatment that they're receiving and the treatment that they have received. Anybody with OCD really has to learn to become comfortable with uncertainty, because the underlying feature of obsessive compulsive disorder is that these people don't like living with uncertainty. And there's this control aspect where they really want everything under control. They want to be able to know that when I'm driving my car, if let's say somebody struggles with an obsessions of harming others, I have to know 100% that I didn't run somebody over. Somebody that's struggling with contamination obsessions, he or she may want to know 100% that their house is free of any kind of contaminants. So that they want to know, they have this very strong sense of this urgency of knowing that they're safe. So part of the treatment is actually helping them become comfortable with the uncomfortable, comfortable with uncertainty. And that's like really the big question that I always ask them. And that is, are you willing to live your life with not knowing? Are you willing to live your life in the gray, so to speak? This has been also, OCD has been coined as the doubting disease, because people with OCD just doubt everything. People with such as, relationship OCD, they doubt the status of their relationship. Do I really love my partner? Can I live with somebody that has bushy eyebrows? Is that quality, every time I look at my partner and I see these bushy eyebrows or a nose that may be a little bit crooked, they question whether they can be in a relationship like that. And they're always checking in. So this is all about doubt, right? So for some of these clients that have been practicing exposure therapy to become more comfortable with doubt, some of these clients have had a much easier time with adapting to the doubt and the unknown that is prevalent now with this pandemic.
Right. And I think that speaks to the greater picture too, right? Of starting to implement and teach skills and behaviors as soon as possible, right? Because when unknown situations like what we're experiencing as a society come up, those foundations are in place. And it sounds like those who already have some foundation in place are better able to tolerate and better able to work through the discomfort.
Exactly. Because, having, it's like one of my clients that have struggled for many months with a fear of contracting HIV. Right? And this fellow, he refused for a long time to shake people's hands or to touch things which other people have touched. And he used to have his, there were certain people that he would think, oh, this person may have HIV, so I'm going to stay far away from this person. So after being in treatment for a while and having learned to live with the uncertainty that, yes, well, I may or may not, contract HIV by touching something, right? Because we're not going to go ahead and provide them with the reassurance that that's not how you contract HIV. Well, because they do know that. They know that anyway. You can show them all the research, but that doesn't really help the person with the OCD brain. So, however, after weeks of treatment where this person is, able to watch, YouTube videos of about HIV, in which where his anxiety has been, spiking and, really getting up there, and it's really peaked. And while thinking, I may or may not get it, I may or may not die. And I don't know. And sitting with that anxiety and then really trying to bring to the forefront what's important to me. What are my values? What's really, what are my goals in life? What's really important for me to achieve, and bringing that into his field of vision. So having practiced that for several months, this person has been much, he's been prepared to struggle with the natural anxiety that we're all struggling with COVID. Looking at the news and seeing people, unfortunately, tragically passing away at young ages. So these people sometimes are better prepared.
Great example. Thank you so much for sharing that. And speaking of, the presentations that we see of obsessions and compulsions, how can a professional help to identify if behaviors, especially right now, are rooted in OCD, or if it's a general fear to, what we're experiencing as a society with COVID-19?
Right. So that's a great question. Because right now, a lot of the different things that you and I and all of us are doing right now to try to prevent ourselves from getting COVID, these are typical behaviors that your person with OCD will engage in on a regular day. Wiping down surfaces multiple times a day with bleach, right? Washing their hands multiple times a day, constantly checking out, the news to find out like what's the latest status. These are things that a typical person with OCD would be doing, and now everyone is doing that. So how do we differentiate between what's typical, expected behaviors and that which is OCD? So for the person with OCD, when they have an obsession, when they have an urge to go ahead and wash their hand, it usually comes along with this, what I call stickiness of mind, and it feels like OCD. So what I've been advising my clients is that if it feels like OCD, then it's OCD, right? So if something walks like a duck and quacks like a duck, it's a duck, right? So it's the same thing with OCD. They're really being instructed. All the clients are being instructed to follow through with whatever the CDC guidelines are. Mm-hmm. And right now, if I'm not mistaken, it's washing your hands for 20 seconds. Now, a person with OCD that engages in hand washing, typically a 20-second hand wash is not going to suffice, because they hand wash until it feels right to them. And 20 seconds, when it's imposed upon them by some external, system such as the CDC, these external guidelines, it's not necessarily going to feel right for them. So they can still continue doing their exposure therapy. Mm-hmm. Instead of instructing them not to wash their hand after they use the bathroom, or not to wash their hand after they touch the dumpster or perhaps a toilet seat. And now, of course, we're instructing them to follow through with the CDC guidelines and to stick by those guidelines. Also, a big area is a lot of clients with OCD have been checking out obsessively the TV, listening to the news, going on Facebook, so in order to make themselves feel better. So that's where the exposure therapy would come into, where we would advise them to just go on for 5 minutes a day, a reputable source, such as the CDC, and just keep it at that and not to go on again. Because there's so much news out there. There's so many conflicting reports. And if somebody with OCD, that is going to cause them a tremendous amount of stress. And that turns into a compulsion where they're constantly checking out and listening to different news agents. So that's something that we want to help them refrain from doing.
Yeah, that makes complete sense. You know, we are inundated by the media during this time, and there's so much news to take in. We could easily spend our whole day, you know, just engaged and fixated
Right.
on some news that doesn't sit very well with us. So yeah, those are best practices to navigate, you know, and discuss with our clients. We're getting some questions in from the audience, and this is a very good and practical question. As a private practice therapist who works with OCD, I have concerns of when I reopen my practice to live sessions. Do you have any thoughts on how to support clients as we transition from virtual to live?
So that's really a great question, and I'm just wondering specifically what are some of the concerns that the questioner has.
Sure. Well, it sounds like, in speaking specifically of exposure therapy and having, you know, those deliberate conversations that you were just discussing, and, you know, best practices of observing. Any thoughts on how to incorporate that either into the virtual world or back out of the virtual world?
Right. Okay. Yes. So that is definitely certainly a challenge right now, because typically, and also as a clinician that also has a private practice outside of working at Lifeskills, it's something that I am struggling with right now, and that is due to, you know, we do exposure therapy. That's what we do, and right now we can't really go follow through with all those kind of exposures that we've been doing in the past. So as a number one, what I would recommend is, of course, following through with the CDC guidelines, whatever it is that they're recommending. So once they ease things up, so then we would be able to, you know, slowly but surely get back to the way we were treating prior. You know, and this question really touches upon a liability question as well, a liability concern for us, and also in terms of our, you know, practice, as well as liability for the person to keep them safe, because this is a real health concern. So that's why we really have to follow through with the CDC's recommendations, and become very creative in how we can further support our clients with exposures. So let's say while they're living at home, we may be able to identify certain things at home within their home setting that they are avoiding. Try to work on those exposures, because the idea is that at home, somebody, you know, whoever's living in the house and sharing the house, you know, we could imagine that, you know, we would have whatever our partner has, whatever our family members have. So then we can continue doing whatever exposures we were doing within the home setting. So limiting the wiping. If, let's say, the CDC says you only have to clean things with bleach a certain amount of times or wipe down surfaces, let's say once per day. So then following through with that and not doing it any more than that. And trying to identify what are the items, the people that this client with OCD is avoiding, and then practicing those exposures within their home setting.
Yeah.
Yeah.
Great. And as an additional question to that, what medications, if any, are useful in treating OCD?
So typically, so again, full disclosure, I'm not a psychiatrist. So working as a licensed psychologist, very often, the SSRIs, selective serotonin reuptake inhibitors, are very effective. Some other medications.
Absolutely. Great. Thank you. Now, I hear, as we've been continuing to have this discussion, you've been helping provide some practical skills that professionals can utilize, both, in therapy and encourage outside of, the clinical time that's spent together. Can you give us some additional, skills of maybe what's even recommended by, the International OCD Foundation, that might be beneficial to start incorporating?
Sure. I actually uploaded a little handout, something that people can go ahead and cut out, print out and then cut out and provide to their clients. It's like a toolbox for uncertain times, and this is really helpful. This incorporates some exposure response prevention therapy strategies, as well as some mindfulness techniques. Of course, if you take a look at the top left, the first step is to just stop and breathe. Very often, we're not breathing properly, right? So this is getting into a mindfulness stance, and then just noticing what I'm doing.
Some of that deep cleaning I can help with. I just can't do it.
Okay, and then
sorry about that.
Sure. And then it would be just really starting just to notice what's showing up right now. What's showing up in my, in my brain? What thoughts are my brain producing? Because that's really what the mind is. The mind is it's a mind machine, and it produces thoughts. What emotions are showing up in my body? What physiological sensations am I experiencing? Just noticing that. And then after that, just asking oneself, is this OCD, or is this just a valid concern? And a person with an OCD brain will know that. They'll know, because if it feels sticky, like I said earlier, they'll know that this is OCD. And then really externalizing the OCD, like, what is my OCD telling me to do or feel about a situation? This is about becoming less fused, less hooked with the actual thought, and recognizing it for what it is. It's a thought. It's my OCD talking. And then making a decision as to, like, what is it that I'm going to do? Am I willing to sit with the discomfort? Am I willing to allow the anxiety to be there? Am I willing to allow the tightness in my chest to be there? It may or may not kill me, right? Again, it's all about the may or may not. We don't want to ever say, we don't want to ever ascribe any kind of certainty when we're working with OCD. It's all about keeping everything unknown and allowing it to be there, and waiting for, with time, that anxiety will actually subside. And then basically deciding, like, what is it that's important to me? I got up today. What is it I want to make today worthwhile and meaningful, so that when my head hits the pillow tonight, today was a day worthwhile, a day worth living.
Yeah.
So these are, if you just go through all these steps, it's about taking back control, and not allowing the OCD to control oneself.
That's incredibly helpful, Dr. Dovid, to see and hear. As you said, these are some, ideally easy steps, right? Like stop and breathe. And how often in our busyness of life, we don't stop and breathe as fully and as deeply and as, much as we're able to really help recenter ourselves and refocus, and just how that translates then, as simple as it sounds, into even bigger concerns and presentations.
For sure. And breathing is also so helpful. And it works because the idea of breathing in is a form of acceptance.
Yeah.
You breathe into something, that means on a certain level you're accepting the experience for what it is. Like, the breath is all about its life, its vitality. So we want to be able to create space. Instead of rejecting and resisting what's showing up, we want to create space for whatever's showing up, whether it be an intrusive thought, whether it be an intrusive emotion, an emotion that doesn't feel right. So, there's this concept of what you resist persists. We want to be able to drop this tug of war. Life, if we try to push something away, then a tug of war ensues. And you have, this idea of the worry pulling on one end, and then on the other end, the reassurance where a person tells him or herself, no, this is okay, you're going to be okay, whether that's done mentally or whether that's done behaviorally, like in the form of a compulsion. Then you have this whole tug of war. We want to be able to just drop the rope. So when we drop the rope, when we drop the struggle, of course the discomfort's going to be there, but over time, the person is going to become habituated to sitting with this feared consequence. This may happen. And after a while, they will actually retrain their mind, retrain their amygdala, right? It's okay. And something may or may not happen. And I have today to live.
Yeah. Yeah. I was thinking of that from the beginning when you mentioned sitting with some level of, discomfort. As the care professionals that we are, and I'm thinking even more so taking that, outside of professional into personal, even parents wanting to provide support to their children and assurance of things will be okay. We want to say that and we want to provide that. And, taking a step back from that, especially with our clients, now you've mentioned it several times, but how do you encourage having that conversation?
Having this conversation with clients or with children in general?
Both.
Yeah. So as a parent, my children have learned that I'm not the person to go to for seeking reassurance. I'm there as the stable parent figure, and of course, to always be there for them and for their needs. And when the question is just about reassurance seeking, what I've found is that the question will always come up again and again and again. And we have to allow ourselves, our loved ones, and our clients to be able to learn to live with some level of uncertainty, because really we don't know anything. We could only try. We could only try to be successful. We could only try to be safe, and that's all we can do, right? The outcome is never really in our hands, although we may tend to think it is, but the process certainly is, and the process is what's important.
Right. Well said. Well said. Speaking of working with children, at Lifeskills, we certainly work with adults, but we have many professionals who've joined us today who do also work with children. So a question came in from our audience. Do you have any recommendations to integrate with young kids who are struggling with anxiety as a result of COVID? For example, vomiting, dizziness, afraid to leave the home, things of that nature.
Right. So in a situation like that, and this does become, this can become very concerning, because when our children see us responding with anxiety and constantly looking at the news, and sometimes it could just be a comment of, I don't know what's going to be. So we may be modeling for our children to be anxious. And to a certain point, to a certain level, it's okay to have anxiety about this. There's something called like normal anxiety, but it certainly becomes unhealthy once our children are presenting with symptoms such as vomiting or avoidant behaviors. So that's when we want to be able to also minimize the amount of data that's coming in through social media, through the different TV networks, because then it's just, we're flooding ourselves and with so much confusion. So the best is to really rely on a reliable network. The CDC is, really the best place to go right now, and to keep it limited, and to try to, if a person can get out, right now people are starting to slowly get out, to really model these behaviors for our children or to, to instruct the parents that we're working with to model these kind of behaviors for their children, to be able to go out and do those exposures with their family members. So of course, when a child is worried and vomiting and crying that, I'm going to die, that's most likely not the best time to say, oh yeah, you may or may not die. That's certainly not the right thing to do in the moment. We want to be able to give our children a sense of security. That's something that children need. And at the same time, balancing that with, in life, we don't always have the answers. And, people are working on figuring things out, and we're here together as a family. And what's important really to do is to make today count. And what can we do today to not allow COVID to control us, and, and instead allow us to gain, some sort of control over the situation in terms of living our life to the fullest today.
Absolutely. I think that was very well said. One takeaway that I have just listening to you speak on that is that, while there may not be 100% assurance, there can still be security in the unknown, right? And that security can look like parental love,
exactly.
Connection with each other as humans, some social support that's there. So there's security despite, the 100% reassurance that's
exactly there. Like not disrupting, if there's a certain time that the family has dinner, not disrupting that family time to go ahead and check out the latest on COVID, right. To be on the phone checking out, oh boy, what's, this, somebody just died, this, well, or this happened. We want to be able to maintain the structure that we have in our homes to the best of our abilities, and to not model anxious behavior for our children. So like you said, there is a fine balance between security and too much control, because part of teaching our children is that we don't know in life, and and at the same time you're secure. And we can demonstrate that by giving a hug, giving our child a kiss, tucking them into bed, spending time with them, not as a form of distraction, because distraction, again, is a form of trying to avoid, but rather just we want them to feel that they're that they have a sense of security in their lives.
Sure, absolutely. Now we have time for one more question. This one's a little bit of a lighter note and personal note for you, Dr. Dovid. This situation, of course, can be very traumatic in different ways for all of us navigating uncertain times. So we're curious how you are taking care of yourself, and if you have any tips for us on best self-care.
Of course. Self-care is, oh boy, it's so important. And that's one of the areas that I find myself sometimes lagging in, and where to the point when I check in with myself and like, whoa, 1 second, what am I feeling? What am I noticing showing up? Did I take a break today? And then just really, I love doing mindfulness, practicing meditation exercises. I find that unbelievably helpful, and it goes a real long way. It's extremely rejuvenating. A simple 5 to 10 minute mindfulness practice, and I try to do those daily. Also putting in a good night's sleep. Just when I'm rested, then my tank is full.
Yeah.
So, the exercise is another great outlet for me, although right now with all the gyms closed, and I think they're opening soon, or they may have opened on some level. So hopefully I'll be able to get back to that. But self-care, if our tank is not full, there's no way that we can help our clients. So that is certainly something which is so important. Eating healthy, sometimes even just sitting down and watching a good show on Netflix.
Sure. Absolutely. All good things. Well, thank you, Dr. Dovid, for your time and for sharing all that you have with us today. We are grateful for your experience and your kindness and the attention that you give to everybody, not just your clients. So we're grateful. Thank you so much.
It's my greatest pleasure. Thank you, Amanda. Thank you, Ethan. And thank you, everybody, for coming and joining. I really enjoyed the time that we had together, and wishing you a great day.
Thank you. If anyone has any additional questions, about life skills, about cognitive behavioral therapy, and anxiety or OCD, feel free to reach out to myself and Dr. Dovid. We're happy to answer any questions. So Ethan, I think you might have a few updates.
Yeah.
Now I'll hand it back to you.
I will just wrap it up. Amanda, Dr. Dovid, thank you so much. You guys rounded out, I think this is week 9 of our Meet and Eat series. So you are our last one, Dr. Dovid. So thank you. Thank you. And starting next week, every week on Tuesdays between noon and 1 o'clock, we're excited to now offer CE presentation. So starting next Tuesday at noon, we have a 3-part series beginning next week on technology addiction, led by Dr. David Greenfield of the Greenfield Recovery Center. Most of you should have received an invite for that, but if you didn't, feel free to shoot me an email and I will get you added to that. But make sure you get those on your calendar. We're planning for at least September to have a weekly CE for you all. So again, if you need that information, let me know. But again, thank you all, and I hope you have a great rest of your day. Thank you.
So take care. Be well.